Hello, my name is Ivy. I'm a fourth year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about post-traumatic stress disorder. In this video, we'll first look at what post-traumatic stress disorder is. We'll then look at some statistics, risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Post-traumatic stress disorder, or PTSD, is a negative and anxious response to an event that is dangerous, frightening, life-threatening, or shocking that happened to oneself or others. People with PTSD repeatedly relive the event or try to avoid reminders of it. The thoughts of the event can significantly affect people's lives long after the event has ended. The traumatic events can include abuse, sexual violence, crimes such as robbery or kidnapping, disasters such as earthquakes, hurricanes, or fires, serious accidents such as car accidents, death of a loved one, serious health concerns, war, and terrorism. Statistics. Approximately 9% of Canadian adults will experience post-traumatic stress disorder in their lives. In the United States, around 6 out of every 100 people will have PTSD in their lifetime. Around 12 million adults in the United States have PTSD in a given year. Women are twice as more likely to have PTSD than men. Risk factors. The risk factors for post-traumatic stress disorder are experiencing a dangerous event or trauma, a personal history of mental health conditions or substance use problems, excessive fear or helplessness, disassociation after the trauma, lack of support system, feelings of shame, guilt, or responsibility for the event, and additional stress after the event, such as an injury. There are groups that have a higher risk of developing post-traumatic stress disorder, including refugees who have experiences such as war or family separation, first responders such as police, paramedics, firefighters, and search and rescue professionals, military personnel, Indigenous people who are residential school survivors or have faced discrimination in their daily lives, and medical or mental health professionals who work with people who have trauma. Symptoms. The symptoms for post-traumatic stress disorder typically begin within 3 months of the traumatic event, but they can also begin years later. An adult must have the following symptoms for at least 1 month: at least one re-experiencing or intrusion symptom, at least one avoidance symptom, at least 2 arousal and reactivity symptoms, and at least 2 mood and cognition symptoms. Re-experiencing or intrusion symptoms include flashbacks of the trauma, including a racing heart or sweating, nightmares, and fearful thoughts. Avoidance symptoms include avoidance of places, events, or objects that remind a person of the traumatic experience, avoiding thoughts, feelings, or talk about the traumatic experience. Arousal and reactivity symptoms include irritability or anger outbursts, hypersensitivity to dangers, tension and anxiousness, difficulty sleeping, and being easily startled. Mood and cognition symptoms include difficulty remembering significant aspects of the traumatic event, guilt or blame, a loss of interest in activities, emotional detachment from others, difficulty concentrating, and mental health conditions such as depression, phobias, and anxiety. Besides the previous criteria, there can also be physical symptoms such as sweating, shaking, headaches, stomach issues, chest pain, and dizziness. For children under the age of 6, symptoms can include bedwetting, difficulty speaking, acting out the event, and clinging to an adult. Effects. Post-traumatic stress disorder can result in other issues, such as school or work issues, depression, anxiety, personality disorder, misuse of alcohol and/or drugs, thoughts of harm, and suicidal ideation or attempts. Treatment. Treatment for post-traumatic stress disorder include trauma-focused therapy and medication. Psychotherapy is typically the first treatment. Psychotherapy can occur individually or in a group setting. Psychotherapies focus on education about symptoms and effects, help identify triggers, help people understand the connection between their thoughts, feelings, and behaviors, and teach coping skills to help process the traumatic event, including relaxation skills. A popular form of therapy is cognitive behavioral therapy, which can include exposure therapy, which helps people face and control their fears. It is done through gradual and safe exposure to the trauma using imagination, writing, or going to the location of the traumatic event. The mental health provider helps patients manage their feelings. Cognitive restructuring. This therapy helps people better understand and think about their difficult memories. And eye movement desensitization and reprocessing. This therapy requires a person to focus on sounds or movements while thinking about the traumatic event to gradually lessen their distress. Medications such as antidepressants may also be prescribed by a mental health professional to relieve anxiety and help with issues such as mood or sleep. Coping strategies. Coping is a key component of recovery. Coping methods can include educating oneself about post-traumatic stress disorder, understanding that symptoms can improve gradually, being confident one can cope with their memories and emotions, thinking positively, including more laughter in one's life, finding positive meaning from the traumatic experience, perceiving oneself as a survivor rather than a victim, breaking tasks into smaller, more manageable ones, confiding in a loved one and informing them about triggers, helping others, engaging in physical activity, practicing relaxation and breathing techniques, listening to relaxing music, spending time in nature, doing enjoyable activities, and seeking out comforting places, experiences, or items. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.